Welcome to the Listen Up podcast, where we explore hearing loss, communication, connections, and health.
Hi, everybody. Dr. Mark Sims here. I'm the host of Listen Up podcast, where I feature top leaders in healthcare. This episode is brought to you by the Listen Up Hearing Center. I help patients to effectively treat their hearing loss so that they can connect better with their family and friends and remain independent. The reason I'm so passionate about helping people with hearing loss is because I lost my brother Robbie twice. First to his hearing loss from radiation to his brain tumor, and then later when he passed away. I'm an ear, nose, and throat doctor who only cares for ears. I'm the E of ENT. I've performed over 10,000 ear surgeries and taken care of many more with hearing loss. I'm the founder of Listen Up Hearing Center. I'm also an author of a book of the same name, Listen Up, A Physician's Guide to Effectively Treating Your Hearing Loss. If you want to learn more about that, go to www.listenuphearing.com. Today, I'm excited. We have Anthony Florek from Soundwave Hearing. He has over 30 plus years in the medical device space, including working for Johnson & Johnson, Allergan Medical Optics, and Beltone, which is part of GN Hearing Care. He brings 15 years of experience from traditional hearing aid industry and leads the development of the business model and the value proposition at Soundwave Hearing. That's what we're going to learn more about today. He's a Bachelor of Science in Marketing from Indiana University and an MBA from Northwestern University Kellogg School of Management. He added to my bio, which I think was really wonderful, that he has a lovely wife and 3 boys and lives in Chicago area. So it's great for him to add his personal side of himself. We're really excited to have him on the show. Thank you very much for coming, and it's great to have you on.
Mr. Sims, thanks for having me. Absolutely.
Oh, sure. My pleasure. Please call me Mark.
Yep.
So tell me a little bit about your journey into the hearing space. I mean, everybody gets there somehow, obviously, because we're speaking, but how did you get there?
Yeah, I'll give you 30 years in 3 minutes or less. So
okay, that's probably, people would probably like that.
Yeah. So I started
out 3 minutes and 30 years to take you to tell us. So.
Yeah. Right. So I started out with some consumer product experience with Johnson & Johnson, like you mentioned, got into medical devices because of a roommate. Was into eyeballs, cataract implants, and phacoemulsification and LASIK equipment. Carried a bag and managed a group of folks that here in the Midwest for a company called Allergan. I often joke with people that I worked my way down the body from eyes to ears. Ended up at Beltone as their VP of Sales and Training, working with the network owners and the corporate stores in North America, U.S. mainly, and Japan, and had a wonderful time. Learned everything I know about hearing care during those 11 years. And at the end of 2016, I joined a startup at a health tech incubator called Matter down at the Merchandise Mart in Chicago. Originally started as, it's called Resonance Medical. Originally started as part of the Invo Innovation Program at Northwestern University, was one of the founding members of Matter. And when I met these guys, they were basically putting together a hearing threshold, an audiogram, a hearing test on a mobile phone. And I was fascinated by that because this whole OTC thing was starting to percolate. And lo and behold, in 2017, that Hearing Aid Act, OTC Hearing Aid Act passed. I spent about 1.5 years with Resonance Medical helping them develop that software. And then in 2018, I started out on my own, formed Soundwave Hearing. And my first partner, Joe, is our hardware guy. He's the chief engineering officer and is really the brains behind the hardware design. And then my second partner, Chris Bovin, is a computational neuroscience, almost PhD, and is really the brains behind the otoTune app and the hearing test. And that's what we married together. It took us 3 years to do that. But so Soundwave, when we formed Soundwave Hearing in 2018, we ended up buying the assets and the patents and all the software
of the prior company.
Of Resonance Medical. They put it all together. And it took us 3 years to match the software with the hardware. And we launched in January of this year. So very, very exciting.
Congratulations.
Thank you.
So tell me about, the idea. So you had been working in the on the online or the mobile hearing test, and then so what was the idea to marriage it with the hardware? Tell me about that.
So when I was at Resonance Medical and we were trying to license the software and raise money, all the venture folks said, "Geez, this is interesting, but you need a device," and that's really a business model we can wrap our arms around. So we decided to venture off on our own. We looked at a lot of potential partners, but we ended up designing, engineering, and assembling on the product on our own. It's our actual hearing aid, and we have a contract manufacturer that's ISO 13485 approved and FDA registered, and assembles it for us here in the U.S. They have military and aerospace applications that they work on, and we're very excited about our hearing aid design and the software that partners with it. The idea is it's really a starter hearing aid designed for folks, probably younger patients, probably patients with mild to moderate loss, first-time users, to get them down their path of better hearing health. May not see the value of spending a larger sum of money through a hearing provider's office, but may want this as a do-it-yourself kind of solution that, again, starts their journey.
Just real quick, tell me about what's ISO 13. I don't know what that is. So
I'm not sure either, but it's a requirement. It's a good manufacturing process requirement.
Okay, certified
ISO.
manufacturing.
You bet. That the FDA requires for all hearing aid manufacturers of an OTC device, and actually all FDA registered medical devices.
And so, one of the big things in the devices are the chip. Is it your chip, or are you using somebody else's chip?
We're using someone else's chip in their digital signal processing. We use their suite of firmware to develop to work with our app and our hearing test. The app otoTune is downloadable on an iOS or Android platform. It comes free with the hearing aids. So the idea is the patient orders it online or through a hearing care provider. I'll tell you about that in a minute. And that idea, they get it from us or from the provider. They sit down at their kitchen table, take it out of the box, download the otoTune app through the App Store, the Google Play Store, register because that's going to be an FDA requirement. Takes a tutorial on how to put the batteries in, how to put it on their ears, and then it takes a hearing test. And what differentiates, Mark, us from, I think, every other direct-to-consumer product is the way we do the test, right? So we actually produce a hearing threshold. We measure all the frequencies, all the intensities in both ears in 3 minutes through the hearing aids at someone's kitchen table. And then they press program.
So the hearing aids are the presentation device, not not earbuds or the speakers on the phone.
Correct. Yeah, we have a 16-channel behind the ear receiver in the canal hearing aid that we think is a nice product. It's as small as other direct-to-consumer products, probably smaller, and it pairs nicely with our otoTune.
And so then they do a test, and then it generates the program.
Yeah, it generates the hearing threshold. In our next public release, which will happen probably in the first week of July, we're going to follow all the OTC guidelines, right? We applied for a 510(k) application to become an OTC hearing aid. And in our next public release, one of the exciting features is, gosh, if someone has a profound loss or severe profound loss or asymmetric loss, it'll tell the patient to stop, give them a warning sign and tell them that this product is out of range and we can't help you, and go seek a hearing professional.
Oh, that's great.
And then no one understands really how to read a hearing threshold. So we have a report card feature that talks about the low, mid, and high frequency loss and what it means for that patient. So we're trying to help educate them as well.
Sure. So when you mean a report card, ABCD or some sort of different way to do it?
Yeah. So here's the hearing threshold. I think you probably see that,
typical
right?
Audiogram graph, right?
Yeah, everyone recognizes that. And then here's the report card, right? So it's, it talks about the mild,
so
high
it's green,
frequencies.
low, middle, and high frequencies. Green, yellow, red on one side, orange on the other. Okay.
Yeah, a very simple way to help.
Charted way to tell them where they are.
Yeah, right, exactly. And then we have a very simple control screen with a volume slider. It's got 3 modes: quiet mode, omnidirectional, adaptive directionality and noise mode, entertainment mode, which is fixed, and then it's a smart hearing aid. It has some smart features like automatic mode selection, depending on the person's listening environment. It'll switch automatically. So we're trying to make it easy and simple. It sounds very nice. It's got a very good digital signal processing sound. I think people, including in the audiology community, will be pleased with this as part of a tool in their toolbox to present to a patient, perhaps that they tested and was not treated for some reason, or comes in and wants to know a little bit more about the OTC category.
Great. And so you're looking at a dual distribution model, meaning direct to consumer and then through professionals, or how are you?
Yes. We purposely set up Soundwave and their business model and the entire value proposition to work in a wholesale environment and directly to consumers. So you can go on hearsoundwave.com and buy it as a consumer or as a hearing professional. Go to our professional page and sign up for a wholesale account, and we'll ship it to you directly that way. You can buy it through Westone and soon some other wholesale audiology wholesalers. Ideally, I think the hearing care providers, it's our theory that the ones that are smart and embrace this OTC, what's happening, the regulations and the change of the rules. It's one of the biggest opportunities in hearing care, I think, ever. It's just a really large lead generation program that I think the smart leading edge, the innovators, the early adopters, embrace those folks that are coming in, that are starting their journey. Again, that's probably a younger patient, super hard to get, probably have a moderate hearing loss, don't want to spend thousands of dollars, but might want a do-it-yourself solution. So, every hearing care provider knows that a tested, not treated patient, which at Beltone happened 40% of the time, right? So if there was 10 hearing care evaluations during the week, 4 of them walked out with absolutely nothing. And the cost of acquisition to put them in that chair and the chair time alone could be well over $1,000, right? So you're going to make 30 or 35% margin on a lower price item, but you're not losing the opportunity of selling that person in the future with a prescription hearing aid a second, third, or fourth time. And that's really the folks that think long-term. I think it makes the most sense for them.
So just out of curiosity, so in that particular thing where the professionals, they're still self-programming, or how is that working?
They are, absolutely. So the patient can take it home. The practice can fit it in their office. They can service the patient. They can sell them a service contract. They can do it a la carte or sell it to them annually. They certainly want to keep that patient in the provider's ecosystem and their purview of care. We know just through tracking that patients come back 83% of the time when they need to upgrade their technology after 2, 3, 4 years. And if you are able to successfully fit a patient with a solution, and by the way, it might be a PSAP, it might be a hearable, it could be an over-the-counter hearing aid like Sontro. But I think the providers, I think it makes sense for those providers to have a cabinet solution to offer them.
Sure.
And that's the idea behind it.
Right. Yeah. So it's one thing caught my mind. I don't know a lot about the OTC regulations because people like you have to know it because you're rolling out the products. But you said so. One of the things is it has to be registered. So what has to be registered? The patient. What else needs to be known when you're saying? So the registration process in your app for your device. What does that account?
Name, address, phone number, email, a few other questions. So it's not onerous by any chance. But I'm sorry.
Age, I assume.
Yes. Yeah. I think it's a range. And these were these were part of the requirements of the OTC published regulations, proposed regulations.
What's the rationale for that? Do you know?
My guess is for tracking recall. In an unlikely event that there's recall. So we took those proposed regulations very seriously. We're going to abide by those guidelines. Right. We're currently a Class 2 FDA registered device. We'll apply to become an OTC hearing aid, and when the final regulations are published, we'll obviously abide by those rules. So a 510K submission for an organization that's starting out is no small feat. Takes a tremendous amount of resources, and in the end, probably is a competitive advantage at some level. And if the FDA enforces the rules like everyone thinks they should or will, I think it gives companies like us an opportunity to really benefit from helping consumers, partnering with the audiology community, and just bringing hearing care up a whole nother level.
So in terms of your rollout, what do you expect? I mean, how are you going to get, not that you shouldn't, but how are you going to get this in people's ears? Are you going to go and is it, you were, the sales network for Beltone. Is your plan to go out and you can't knock on all those doors. So what are you going to do?
No, it's a good point. So
a lot of doors.
There's a lot of doors. I know that. So we were at the American Academy of Audiology in St. Louis in March. We got a fantastic reception there. There is interest. I send out emails. I connect with people on LinkedIn, through social media, through venues like this. So that's how really we're going to get the word out. For me to knock on all the doors is going to be difficult. But as we grow, I hope to attract talented people that want to help this cause. And I'm anticipating that could happen. So it's going to be a little slower in the beginning, but I think it picks up once OTC regulations are.
Right. And how about direct to consumer? How are you doing that digitally as well?
Yes. Yeah. Digital marketing campaign. It's going to take some time to grow and build that. We understand that. So you'll see us on Walmart.com. Eventually, probably next month, you'll see us on Amazon because we need to be in those platforms because that's really the only other way we can play at this point, other than through the audiology community. And then once the regulations happen, there's really a blue ocean of opportunity, right? I'm getting a tremendous amount of reception from the pharmacy community through pharmacy benefit managers. And we're talking to Medicare Advantage hearing benefit managers as well. So there's a high level of interest to manage another disease entity with these drugstores. And again, the smart hearing care providers embrace this channel because these are, again, almost all of them are first time users. And that's such a valuable patient. And they're going to outgrow a mild to moderate indication for an OTC product. They're going to need a prescription hearing aid. It's a really large lead generation program. I think it's super exciting for hearing care, for the folks that embrace it, right? And the hearing care providers, the ones I'm talking to, the ones that are really on the leading edge, they're digitally marketing these products already on their website, right? They're doing direct mail and newspaper and in TV and in their local markets. And they've been doing that for decades probably. But this whole digital marketplace and actually marketing the product online, that's something that's a little different. I'm seeing more and more of it. And I think folks might have 10 stores in a given marketplace, but don't have the market share that they want. They want to help more people. And this digital space, I think, is a place to play. And I think OTC is a platform for them to use.
Yeah, no. And so do you have enough people out there? I'm just curious how many people, you might not have a big enough market experience yet, are trying the device and then the audiogram says you're not within our fitting range, or do you not know that yet?
No, we don't. But I anticipate 15 to 20% probably fall outside the range. And ultimately, our goal would be to partner with
Any care.
Yeah, or a hearing care network of some sort that says, hey, and go see your local audiologist. No, by the way, press this button on the app and we'll geo-track a location near you as part of our network. Again, a big lead generation program with the right group of progressive providers that understand it. Yeah.
And so where's your roadmap? Like, okay, so not that maybe you're not seeing past the OTC regs coming out because that's probably a huge thing in front of you. But where do you see yourself going from there?
I mean, that's a big animal to wrap our arms around. So we'll be able to play in that market for years and grow with that market for years. I mean, right now we're working on our next platform, which will be streaming. So we're a Bluetooth-enabled device with our app, and our next stage of product development will be a streaming product. And then the next stage at the end of this year, ideally, will be rechargeable and streaming. So we'll have different price points
so
for different
iterative improvements of the devices, right?
Yes. And then we can play in different sales channels, right? I mean, I'm seeing all sorts of sales channels being developed. I mean, in Verizon stores, as one example, which I don't think people even thought possible, even 2 or 3 years ago, you're starting to see some of these channels, not just drugstores. And then there's international growth, right? I mean, there's just a huge hearing loss community internationally that's tremendous. And with the right partners, I can see us playing in that kind of market.
So, switching gears a little, it sounds like you've been in the startup space for at least 5 years, right? Is that correct?
Yes. Mm-hmm.
So, what are the hard lessons you've learned in that space? Because I'm sure, outside of the hearing space issue, you're also in the startup space. And so I'm not that familiar with it. So I'd love to hear some of the either good, bad, or hard lessons you've learned in that space.
Oh, it's super exciting. You wake up every day energized and focused, and then you stay up at night staring at the ceiling thinking, was this really the right decision? And ultimately, for me, the answer is absolutely yes. It's super exciting. But, raising money and starting a business can be very stressful to keep your dream alive. So have a lot of money, have a lot of patience, prepare for roadblocks that you never expected, including regulations that
are taking a long time.
Yeah, quite a long time. And, that be playing in a space that's FDA regulated is tough. But in the end, if if the regulations come out like we think, I think we'll have a competitive advantage with how our product is, our design, our software, and the way we're trying to present it to consumers. And we really want to partner with the audiology community. We don't want to disintermediate or disrupt this community. I want to partner with them because I think there's tremendous opportunity here for both parties to take advantage of those patients that are really, really hard to get, really, really expensive to get. But once you do get them in your practice, I think they can be patients for life.
So, so where do you see the audiology community right now? Like by a percentage, like, what percentage are kind of hugging this? What percentage is indifference to it, and what percentage is repelled by it? I'm just kind of curious.
That's a great question. Yeah, I mean,
because you only see the people who want you, I assume.
Yes, I do, and they're super interested, and they want more information about the product, and they're designing their approach with the marketplace. But until the OTC regulations are here, there's really no incentive for them to move quite yet. So we're starting to get some traction. We're definitely a lot of interest, and we're creating some sales because people want to try it and be ready for it. And as we hear more about the legislation that's being proposed, that by some of the folks in the Senate, I think there's more and more pressure. And I think things are getting close. But I would imagine it's sort of like the bell curve of innovators, early adopters, late adopters, and laggards. Whatever those percentages are, I would probably say they're very similar here.
And so it's June. I mean, this does kind of time date the podcast a little bit. Last month, Bose left the OTC market, correct?
They did. It was a bit of a surprise. It kind of
came with a lot of fanfare. So
they did.
Any insight as to their rationale? Is it just not compatible with their brand, or what did they say?
You know what? I think they were struggling overall as a company with earbuds, and I think Apple was taking a pretty big swipe out of them, and I think they decided to circle the wagons,
play somewhere else.
Their medical division was low on the totem pole, and hearing care was part of it. But they had a really great device and a super interesting device, and we watched them closely, and they literally paved the way for companies like us to exist. So we owe a lot to companies like Bose. I mean, they submitted that de novo application, which was not easy to do, and received it, and that's really what we're using as our predicate.
Sure.
510K application.
Well, it's great that they paved the way. It's just kind of interesting to, I mean, some of these companies, unless they see a certain amount of upside, they don't want to stay in a market. That's the other thing.
Yes, they right. So I for a company like us with our size, we can pivot quickly. We have a tremendous software team.
You're pretty lean, sounds like.
We're very lean, which is great. And we can pivot and we can adapt and we could ramp up quickly. And I think it's, we're the right size company for this opportunity. And I think that larger companies eventually will come into this.
Yeah, no, there's a lot of uncertainty right now. So I think being very agile makes a lot of sense, right?
Yeah. And we really don't know what the global manufacturers are going to do, right? I mean, right now they're sort of in this hearable space and they have OTC approval at some level and they're playing around with it, but they haven't really gone into a self-fitting product per se, something like a Sontro hearing aid that does it for patients. I think there's tremendous opportunity for those global manufacturers to get into that space. And maybe they take a look at us. Would that be interesting?
Sure. Yeah, no, very interesting. This is Anthony Florek from Soundwave Hearing. So if they want to find you or your product, where would they go?
They would go to hearsoundwave.com and they would go onto the professionals tab and they can sign up for a wholesale account. They can contact me. My information is there as well at aflorek@hearsoundwave.com. And I can get them wholesale pricing and they can start testing the product with their staff, with themselves, with some patients, and get ready for OTC hearing aids.
Kick the tires, if you will, right?
Kick the tires. And they should do that now, Mark. They shouldn't wait till OTC is here. They should do it now, get excited about it, and really fine-tune their approach. And Soundwave Hearing and the Sontro Hearing Aid can help them do that.
Sure. So the other question I love to ask, what's your favorite sound? I mean, you're in the hearing and sound business. What's your favorite sound?
Well, since my wife's going to watch this video, I'm going to say my wife's voice. which is the right answer. But you know what I really like is I like the sound of the ocean. It's very peaceful and relaxing. We like to vacation there. And we haven't done it in a couple of years because we did this whole startup thing. But our goal is to get this product launched and get it into the marketplace with the OTC regulations here, and then have some fun next year on the beach.
Oh, that sounds great. So everybody, this has been Anthony Florek from Soundwave Hearing. This has been a fascinating podcast episode, and it's been great hearing your story. And, this is one of those times where I think, it'll be interesting to come back to you in a couple of years and say, where are you now and how's it going? And what do you see from that point? And I kind of understand you're like a road and you've got the headlights on, you can only see so far ahead because there's a lot, you don't know if where the road's going to turn.
For sure. Mark, appreciate the opportunity. Good luck with your Listen Up podcast, and thank you for inviting me.
Oh yeah. Thanks for coming on. This has been great.
Yeah.
Thanks for tuning in to the Listen Up podcast. We'll see you again next time, and be sure to click subscribe to get updates on future episodes.